Bold truth: Aberdeen's trusted counselling service faces an uncertain future as grant funding is withdrawn, leaving a gap for those seeking mental health support. But here's where it gets controversial: should a city rely on short-term grants when demand continues to climb and partners falter? A Aberdeen-based counselling provider, Cairns Counselling, has seen referrals nearly double due to rising demand, yet it will not receive continued grant funding from the local council and NHS. The increase came after the abrupt closure of another charity, Mental Health Aberdeen, MHA, which had previously helped ease the city's mental health burden. To manage lengthy waiting lists, Cairns Counselling reduced its free session capacity by half. The reduction followed MHA's closure and aimed to keep services available while demand surged. The service previously relied on funding from the Aberdeen City Health and Social Care Partnership, which Cairns described as essential. However, Cairns Counselling's latest funding request was denied after review by the partnership during a meeting of the City Council's Integration Joint Board, IJB. The organization expressed disappointment at the decision. Despite free sessions, Cairns Counselling asks clients who can afford it to make donations to support the service. In response, the IJB stated it will reassess all mental health and counselling services in Aberdeen to ensure they meet the needs of those seeking help. A spokesperson described the city's mental health support landscape as evolving and said the IJB is committed to making robust decisions that maximize available resources. Claire Mogak, Cairns Counselling's chief executive, acknowledged the challenges and difficult choices facing the sector. She said it was extremely disappointing that Cairns Counselling would not receive financial backing for the coming year and noted the ongoing uncertainty since March about the outcome of the funding review. She warned that the full impact of potential cuts remains unknown, but capacity is likely to be reduced at Cairns Counselling and other services even as demand grows. Mental Health Aberdeen announced in July that it would close immediately after years of service, citing a range of complex circumstances and mounting pressure on its operations. The 75-year-old charity said it had exhausted all options while continuing to try to sustain its mission. Controversial point for discussion: as mental health needs rise, should funding decisions prioritize preserving a broader network of services or target funding to specific providers? What would be the best approach to ensure rapid, reliable access to counselling for Aberdeen residents while maintaining long-term system resilience? Audience question: do you think the city's funding structure should guarantee continued support for core services like Cairns Counselling even during budget negotiations, or should it emphasize broader strategic reviews to optimize resource allocation? Share your thoughts in the comments.